So one of the things I wanted to also ask you about was innovation. Innovation is something that I'm a big fan of. We actually have at the National Readmission Prevention Collaborative, we have an innovation contest each year for individuals, organizations that are moving innovation in healthcare forward, and Providence is doing so much in that area. Can you share with us a few other things that Providence is doing just to help healthcare transform into future delivery?
Yeah, about 6 years ago, we made a decision to hire our first chief strategy officer. We actually had never had one. We kind of looked at the C-suite as making strategy, and it worked fine. And if we started going down this path, we had only one criteria only, and that person could not come from healthcare because we really wanted something different. And so I think I interviewed 24 people before the 25th one was a guy named Aaron Martin who worked for Amazon. And the reason that we picked Aaron was a combination of his entrepreneurial background in healthcare, the fact that he had worked at Amazon on some pretty transformational things around Kindle and online publishing. Cool. And then thirdly, the fact that Amazon, the customer is always first. And what was interesting, by the time we hired him and he'd kind of written a strategic plan, all this before he actually showed up, we decided, well, really what he is our digital innovation officer, with a consumer focus. So since he's arrived, we've invested in 16 different companies, ranging from Kairos to One Medical to Lyra. Lyra, by the way, is a really cool company started by the CFO of Facebook, and it's an EPA type system for mental health services. And we're actually piloting it in our Alaska region, but it's growing like by leaps and bounds. And so all 16 of those organizations that we invested in are all about how do we improve things for the consumer, period. And then what we've done in parallel to that is we've built 3 different companies, 2 of which we've spun off today. So the first one we built was really interesting. We started as entrepreneurial in resident. And so if you were a successful entrepreneur, like you had spun off 2 or 3 companies, we would ask you to come in, pay you X amount, give you health benefits, give you space, and give you access to anybody in the organization, from the CEO, all the way down to a volunteer. And so the first group we brought in was a guy named Mike McSherry. He and his team had started a company called Swipe, and they sold it to T-Mobile. And after like 6 months of research and all that, they identified that the number one issue that primary care doctors were asking about was, I really need an application to help me prescribe apps to my people based upon their diagnosis and everything they were dealing with.
Interesting.
And so he went in, figured out how to extract the right amount of information from Epic, our EMR, put it onto an app, and then to be able to, through algorithms and all kinds of different things, connect people to the right solutions. And when we took it to our physicians and piloted it, it was an overwhelming success. I mean, people are like, wow, this is great. This is going to free my day up, give me a chance to do real email between my patients, see more patients,
great,
et cetera, et cetera, et cetera. And so that company we ended up spinning off. We're minority owners now, and they're growing by leaps and bounds across the country. They're working with some really innovative organizations like UPMC, who's actually having them do different things on top of this. So that was number one. The second one was a company called Circle, which was an app, again, for first-time expecting moms. And we had a really great success rate, meaning that moms that delivered at our place, our hospitals, would tend to keep in the system with our pediatricians at like 3 times the rate historically.
Right.
And then we merged that with a company called Wildflower, where we have minority interest. And now it's a national app company that's doing those kind of things for consumers. And the last one, which is one we think pretty most exciting, is we call it DexCare for now. We haven't spun it off yet, but what it really focuses on is how to triage a patient based upon, starting out with a text message, whether it be, triage them to a virtual express care visit, send them to an express care site, send them to an urgent care, send them to an extra-urgent care, which is almost an ER, send them to ER, et cetera. And that has been wonderfully successful. I think we had almost 500,000 new people connect through the system to that last year alone. All of our innovation in that particular area is all about how do we create better ways for the customer to move through the system.
That's fabulous. I wasn't aware of several of those. Piqued my interest.
Alaska Cares?
Yeah.
One thing before I go on to that, and this will tell you that it really is working for us, that we're actually delivering. So we actually are Providence Ventures company, which owns or has the ownership in those 16 companies, offices in the Silicon Valley. And I can tell you right now, all of the VC private equity firms that are interested in healthcare pretty much come to us first now, because we have proven through the 16, because all 16 we've done have been with other different private equity or venture companies, and all 16 of those companies use our services.
That's great.
So it's been really, really good that way. It's interesting. It's a little more expensive than most of those types of services out there. But we really, again, if we're going to invest in a company, we need to walk the talk. And so we decided to pilot it there. And to date, we've had great success on it. And Lyra keeps growing as an organization, and they're not losing a single customer. And so what we plan on doing is over time rolling that out across the entire system. And what's so interesting about mental health, because not only is it the caregivers, that's also their dependents. Children in particular are able to have much better conversations about what they're dealing with virtually than they are face to face. And so there's so many interesting learnings of how to interact in the world we live in today.
I'm glad you brought that up, because I have a couple books called Health Wealth, and in those books I talk about the need for more widely accepted telehealth. And what I've found is I'm a Gen Xer, and Gen Xers and Boomers are really hesitant to try telehealth because it just sounds so, they'd rather waste half their day going to a doctor's office and rearranging their schedule instead of just trying it once for a basic cold or something. But where I really see it moving the needle, and I think you just started to touch on this, is in rural areas, in behavioral health situations, providing access, timely access. Can you speak a little bit more about how Providence is using telehealth resources and partnerships to address the homelessness issue as well?
Yeah, so the adoption rate for telehealth is really interesting. And what we find is when we finally get someone to use it, the stick rate is incredible. I mean, it's absolutely incredible. We get last one I saw, we had a net promoter score of 98.
That's great.
True
in my house as well, by the way.
Yeah. One of the things that we're rolling out is the new Providence brand as a single organization to the marketplace.